there. You are watching the Nth Degree, and we're talking about the latest in trends, technologies, and innovations happening across the health and media space. I'm Amanda Preto, and I'm here today with a really exciting team. We're going to be talking with Josh Simon to hear what's changing across the influencer landscape. And then we're diving into experts from our Point of Care Center of Excellence. We're just back from the POC event. Let's go. All right, we are here today with Josh Simon, our lead on paid social, who's going to talk to us about the influencer landscape, what's been changing, what our pharma brands need to know.
Hey Amanda. Yeah, it's definitely a lot of interest in the influencer area, and it's been growing over the last few years. When you think of influencers, the big channels right now are really Instagram and TikTok, a little bit of YouTube. Um, Definitely a challenge for pharma, who definitely banks on Facebook more heavily, and influencers don't have quite as big of a presence there. So when you start out and think about what your channel goals are, you have to think about where influencers are really present and getting reach. After that, looking at who you really want to reach, because there are different influencers for each space. So you might want to find someone who's more of a patient ambassador, or you might want to find someone who's an actual HCP. Um, and now with kind of the rise of things like TikTok, those HCP influencers, they might even have more of a consumer audience. So we're starting to see brands tap into them.
Got it. Great direction, Josh. So one thing I know we've talked about, another thing for pharma brands to be thinking about is authenticity, how to keep the content authentic. Can you give us an our direction there?
It's definitely much tougher in pharma, but really co-creating with your influencer and allowing them to speak in their voice, because if they're not, it's going to feel off to their audience. I know it's difficult with the MLR process to kind of go back and forth for their larger content. You might have to go back and forth and shoot this content multiple times, but as long as you're kind of getting their authentic voice into the content, I think you really need to tailor it to that influencer's voice, and that definitely has started to become a challenge with things like TikTok, where the content looks a lot different than we've been creating for pharma social for a long time. So a lot more video content.
We've talked a lot about the audiences. One thing that's so interesting to me, Josh, that we talked about as a sideline, and I think is important for our fans to think about how HCPs themselves are becoming influencers in their own right. Can you speak to us a little bit about that?
When you think about HCP influencers, a lot of them are becoming really direct-to-consumer influencers in their own right, and building these really large brands. They might be also a really well-renowned KOL, but you really have to look at the audience that they're reaching, and what channel they're on, to see what kind of impact they're going to have. So if they're an HCP influencer on TikTok, their audience is probably heavily DTC. If they're an HCP influencer on Twitter, they're more likely to have a more traditional HCP audience. So it really depends on your brand goals. But we definitely have seen HCPs who, kind of bank on the more TikTok style of, dancing videos or syncing things to music and those types of things. But we also have the more scientific exchange happening on Twitter, with a lot of HCPs built around things like congresses and medical hashtags. So there's definitely a mix. I think we've seen brands approach it both ways so far. I think the biggest challenge is really finding someone who's willing to work with you. And not every HCP who has a big audience wants to go public with a relationship with a brand, or pick one brand, or even, I think there's a lot of stipulations around what can you talk about when you're engaged in a relationship, as an influencer. So not talking about any other brands on your channel for an extended period of time, and will that hamper their ability to have a kind of a normal conversation that they would expect to have.
That's awesome, Josh. Thanks. So, what should our brands be thinking about, and how can they start to implement this?
There's also ways that you can integrate influencer programs to things that you're already doing. So I think, one, definitely think about whether the influencer is going to have an impact on your audience. Think about how it sort of fits into all the other channels that you're working in. Can this content fit in your existing social program? Can it fit on your website? Can it go on a YouTube page. I think there's a lot of different options.
Thanks so much for joining us, Josh. We will tap you again to talk more about the influencer landscape. All right, we are now going to talk about the point of care space. In case you didn't know, CMI Media Group has a point of care center of excellence, and part of that team is here with us today. Christine Mormile, Rich Naseef, and Leanna Chin. They are also fresh back from the POC Next event. And in other news, we are members of POCMA, the Point of Care Marketing Association. So we're going to start off with Christine, who's talking to us about the innovations and some key takeaways from the recent POC Next event.
Just to quickly reiterate, for those who aren't aware of the Point of Care Center of Excellence, it's a new initiative at CMI Media Group and Compass that we've founded to help better educate our internal staff, talent, and clients of really the value of point of care and why it's so important to integrate within a media mix. One of the big themes was, as marketers, we need to help our patients more and provide them with the resources and tools needed to feel in control of their health and make best decisions. There were a couple of key insights obtained from some of the sessions in the morning. One session was called The Point of Care. It was presented by Kantar. They had given us a snapshot of the Mars 2023 study that recently came out a few weeks ago. The patient's value of time with their HCP has changed. 2 out of 5 adults, or 40%, prefer in-person care versus virtual, which I thought was very fascinating, given we're in a post-pandemic world. However, 63% of the patients value digital support information. So just keeping that in the back of mind, it's still important to have both digital and offline tactics within the point of care space. HCPs have adopted digital as well. 65% of physicians successfully, or believe they can successfully diagnose via telehealth. And 1 of 4 HCPs utilize patient-wearing monitoring technology. So these physicians are embracing the new technology that's entering the marketplace and landscape.
So, Christine, in this newly post-COVID world we're in now, how are we seeing the patient, HCP, and also caregiver interaction change at the point of care?
87% of patients value pharmacists. I think pharmacists are often overlooked. We get very siloed in thinking, how do we target the physician versus the patient? But pharmacists are a very important part of these decision-making processes. So 3 out of 5 people or patients take home health-related materials from the pharmacy. So, the reality is these patients are looking to their pharmacist to guide them through their medical journey and decision-making process. And so just to wrap up some of the insights from Kantar, point of care is highly valued and trusted environments like doctor's offices, pharmacy, by both patients and HCPs. Point of care drives action and conversations with the doctor and the patient.
So we're seeing that HCPs are busier than ever before. Patients are more overwhelmed and also have more access to information and education than ever before. So what impact is this having in the exam room, in the hospital setting, at those point of care intersections?
The only other thing I'll end on that was very insightful from the conference was another panel called Improving the Healthcare Experience. A big takeaway was HCPs are dealing with a high level of burnout. The other thing that was astounding to me was she isn't seeing patients until 1 to 2 weeks after diagnosis, which gives the patients a lot of time to do research independently, especially after that initial diagnosis of learning you may have cancer. Every patient comes in to meet with her thinking they have an infinite amount of time to meet with her. And this is what's leading to the HCP burnout. And then the other thing that was interesting in the conversation was patients retain less information during an HCP visit. So patients typically learn better through videos or diagrams. So that visual demonstration that might be within a point of care message can be really beneficial and helping, your brand or product or unbranded messaging really shine. Patients also don't make HCPs aware of income issues and challenges with affordability. So this is why patients don't always follow HCP guidance to get a script filled. And also another thing that was very eye-opening, nurses carry the hospital. They are a major point, help expanding the knowledge and consult with patients. And even pharmacists do frequent patient counseling. We need to really focus on how we communicate our point of care messaging and being putting our brands, our clients first in the forefront of putting that message at the right place and the right time when those conversations are happening.
Those are great insights from that conference, Christine, really actionable. And I think great for our brands to know about what that engagement looks like in the interaction between patient, caregiver, HCP. I'd love to shift over to Leanna. Where do you see opportunities for our brands in this space?
I definitely see the point of care space growing immensely in terms of the channels that are available to us. But just honing in on a few key areas that we've seen major growth. One of them is telehealth for sure, just as Christine had mentioned. Um, we saw an increase in the use of telehealth services due to COVID-19. And we saw a lot of our partner suppliers offering telehealth options on their platforms to address the need. And although things are opening back up with the CDC declaring that the pandemic is over, I think telehealth is here to stay. Patients are more comfortable using telemedicine, especially for minor illnesses. We heard at POCMA that HCPs like telehealth for follow-up appointments. For some specialties, it does make sense for even initial visits, such as the psychology space. Um, but most importantly, telehealth provides access to treatment for patients in underserved communities. So I think we'll continue to see more opportunities in the telehealth space.
How about EHR, the EMR space? What's going on there? What should we be looking out for?
So EHR and EMR, yes, we do look at the EHR and EMR as part of the point of care family. We're seeing an increased use in target lists with EHRs and EMRs. And most importantly, we're seeing a shift towards the EMR and EHR partners being comfortable sharing PLD data. It's been a slow process, but more and more EHRs are being comfortable with sharing that physician level data. So I think we'll see growth in that area in the EMR and EHR space. As we're seeing more and more digital opportunities come into the POC space, we're seeing more availability of real-time data, which is allowing us to decide what's the next best action for our target audiences, which I think is providing more meaningful insights to our clients.
So, Leanna, what is your thought on the role of pharmacists at the point of care?
So, reinforcing what Christine mentioned earlier, I do think that we'll see an increased focus on the pharmacist and in pharmacy tactics just because of how the role of the pharmacist and where they fit in patient treatment has evolved over the past few years. We've traditionally known pharmacists to distribute medication. Now they're more involved in counseling the patients on that medication, how to take it properly. Um, there's an increase in minute clinics, administering care to patients for minor illnesses, and then now we're seeing them administer more and more vaccines. So their importance is really growing. Their time with the patients is really growing over the past few years. So I think that we'll definitely see an importance on the pharmacist and in pharmacy with our clients.
How about synergies between DTP and HCP, Leanna?
So more and more of our partner suppliers are capable of offering opportunities in the front office, in the exam room, and in the back office with the HCP. So we're able to own the office um, for some of our tactics and creating a synergy between our HCPs and DTCs and encouraging dialogue between the patient and the HCP. So it's really important that we are ensuring that we remain lockstep with the client and also the creative agency. And sometimes, even with the media agencies, there's a different agency representing the DTP efforts and the HCP efforts. We want to make sure that the dialogue is being shared between all parties so that we're pulling through that own the office, creating synergies, and making sure we're prepping the HCP for that messaging that we're sharing with the patient so that they're prepared to uh, you know, um, speak to whatever messaging that the patient is being exposed to.
So, Leanna, a theme I've seen woven into just about every topic we've been talking about since COVID is how we're taking a more humanistic approach across the board in all ways marketing, advertising, all communications. So, to that end, what are your thoughts on the opportunities and how we can take a more humanistic approach to the HCP patient interaction at the point of care?
So I think the way that we can make sure that we're taking a more humanistic approach in this space is really making sure we're recommending to our clients that they create tailored content and messaging for the point of care space. And that I think sometimes we get caught up in telling our target audience what we think they need. We want to make sure that we're really truly listening to what they're asking for and providing those needs, especially in the point of care space where it's so critical and crucial to decision making in terms of treatment. It's such a short window of when we can really grab their attention. We want to make sure we're providing that messaging that they're asking for, such as patient support, patient education, even coverage. You know, HCPs don't want to prescribe something that they're not sure will be covered for their patient, because that breaks the trust between them and that connection that they're having with their patient. You know, if they're being prescribed something that's inappropriate for them in terms of coverage, it's a real issue on whether or not a patient can afford their medications. So I think that is the way that we can pull through that humanistic approach in the point of care space.
Thanks, Leanna. Okay, so arguably the most critical piece of this entire conversation, and I know what our marketers are thinking about, is the measurement. So Rich is here to talk to us about the role of data and analytics.
So the role of data analytics in this the relationship with the POC vendors, we need to get involved early on with the media team and the POC vendor to establish the flow of data into CMI. As Leanna had mentioned earlier, there's a lot of change happening in this space right now. There's new competitors in the market. There are new offerings from some of our established vendors. Some of these vendors are onboarded to our process, while others are brand new to working with CMI. So we want to work together with media and with those vendors to set expectations early as to what the reporting cadence should be, what metrics are required, and get that, come to an agreement early on just what that should look like. The type and granularity of the data is going to vary greatly. If you just think about a waiting room, for example, you might see a big poster or wallboard in there, and nothing digital about it. But the vendor could provide a list of HCPs who are exposed to that ad because it's in their waiting. Other wallboards could be digitally activated. You could have EHR systems, electronic medical record systems. There will be physician level data available from some of these programs. Other programs, we might be aggregated up to a zip level or a placement level. That's a CMI term. But in essence, our role is, to get involved early, set the expectations for the data that's needed, work with the vendors, work with the media team to get that data flowing into CMI.
Got it. So it seems like plan ahead is the mantra here, right, Rich?
Plan ahead is a good mantra here. And you have to understand that some of this ad space is limited, and some other people may scoop you on that, so to speak. If you want your ad to be the last ad that's seen before that patient walks into the doctor, you need to plan early to reserve that space, whether it's a physical office or a virtual office. You need to plan early to get that space.
What are some potential challenges when our brands are setting up campaigns?
When the data gets flowing, we want to test and QA that data as it comes in from the partners. Make sure it's what we expected. Does the data make sense? Is the granularity and the metrics what was promised? And then we want to try and incorporate that data into either reporting or the client data feeds. Client data feeds are key, or seem to be very important for the POC space. Clients are looking to bring this data into their modeling process. A lot of these POC vendors will offer an ROI type of study at the end of their engagement. And that's nice to have, but really for the client to get the whole picture, they need to bring that data in with all the other data, banner ads, emails, things that are outside the point of care channel. They need to bring it all together into their marketing mix so they can assess the impact of each one of these channels, the POC channel specifically, in the mix.
Got it. Thank you, Rich. Thanks for joining us today. And big thanks to our Center of Excellence leads at the point of care space, Rich, Leanna, and Christine. See you next time on the Nth Degree.